what I'm going to talk about is just specifically looking at kind of IPS for young people who've experienced the first episode of psychosis. We've done lots of work in our trust around kind of helping people under CMHTs and addiction services and other bits. I just really wanted to focus on young people with first episode. And I think that this is a really interesting kind of issue because I think it just kind of plays to the point just made that people are doing IPS, but I think there's that challenge to kind of, we know we've got the principles, we know we've got a fidelity skill, but the real challenge is kind of how do we adapt and enhance IPS? We know it works, but how do we adapt and enhance it? And this was probably one of the first adaptations of IPS, because IPS was developed for people with long-term mental health problems who'd be traditionally under community mental health teams, whereas this is an adaptation for young people. Just to kind of set the scene, you kind of know this, but you know, young issues around kind of autonomy, maturity, and that sense of responsibility are really key issues for young people. It doesn't matter who carries out the surveys. There was one published not that long ago. Young people have their aspirations of the future, and one published recently just said, just want a job. That was kind of one of the key findings. The transition issue is a kind of real issue that we have to kind of think about. You've obviously got the kind of whole issue about kind of people making that natural transition from being a child, adolescent, to an adult. But if we think about it kind of from a vocational perspective, the transition we all made as individuals was we kind of completed our education and then made that transition into the labour market. And I think that's the kind of the key bit we're thinking about here as a kind of transition. And it kind of plays out in a variety of different ways. The reality about first episode psychosis is it occurs at that really critical part of that development, especially vocationally. Often disrupts education and then scars the kind of first entry into the labour market. In terms of kind of young people's kind of goals, it doesn't matter where you look, if you look at the narratives of people as they kind of develop the psychosis, the kind of recovery stories, etc., and increasingly kind of research articles that are coming out from first episode teams, young people see this kind of issue around education, employment, housing and relationships absolutely central to what's important to them. However, we know that as people develop schizophrenia or psychosis, employment rates drop, as does education. That's really, really clear. And it's actually a kind of devastating kind of impact if you look at it, kind of just plot the data out and kind of just look at actually what happens to people as they kind of are in those early stages or the kind of prodromal stages of psychosis. We know it excludes people very quickly from their kind of peer groups, their cultures, etc. And the evidence is really clear, kind of population level. This is population data from Australia because they have it. When it gets mirrored, if you just look at the general population kind of stuff, independent of the course of illness, the best predictor of being in employment is the completion of education. And in England, what that means for us is having got 5 GCSEs. If you've got 5 GCSEs, your trajectory then for the next couple of decades in employment is really good. If you haven't, you take a lower course, and employment's quite a tricky journey all the way through into your 30s, 40s and 50s. Along with that, your earning potential. What do we know from first episode teams? Internationally, they all tell the same story. It's very depressing. I've just pulled out the English data. If we look at Max Birchwood's service, when he kind of started back in the early 90s, he followed up people in terms of their employment rates. When they came into his service, half of them were in employment. A year later, 25%. SWLStG in Nottingham, with his service, 25% were in employment at that first contact. After 3 years, it dropped down to 16%. In West London, Barnes's work, kind of 13% employment rate after 1 year's admission to hospital for that first episode of psychosis. South London, Philip Garrity's work showed that kind of at that first point, 14% in education, but 86% unemployed. 100% unemployed after a year. Those trajectories are kind of just mirrored in every different country where there are kind of first episode studies or teams, etc. I don't really want to kind of labour this. The IPS approach, everybody kind of knows what it is. Here are kind of the kind of key principles, and they're the things we know we have to do to make it work. There's a fidelity scale, which I'll kind of briefly mention in a minute, but each of those things, we know there's a kind of solid evidence base that underpins each of them. There's a reason for doing them. They're not kind of things that are being dreamt up in an ivory tower to kind of think this is what should be done. Solid evidence base. Now, the kind of key part, which is very different to other forms of vocational rehab, is that this is about a place and train approach rather than a train and place approach. And I think if you look at other areas in kind of mental health and other areas of healthcare, we've made that leap into place and train in lots of different areas. Housing support is very much a place and train support approach. Social skills training is a place the person in the specific context and then provide the training and support. Yet we haven't made that leap really in relation to employment. We still believe that we need to kind of train people generically and then they'll make the transition into employment. So we've done it in other areas, which has now made the leap of faith to do it within the employment context. The adaptation for young people is the issue about supported education. Because we're talking about young people from the ages of kind of 14 up to the kind of late 20s, maybe early 30s, that completing and fulfilling educational goals is equally as important as employment outcomes. There's no point setting up a first episode service and having an employment specialist that only do work. And then you have a kind of 15-year-old who's comes into the team and says, you know, what kind of job do you want? I want to do my GCSEs. So it's really kind of contextualising it and kind of pulling it into place. Now, in terms of the adaptation, Keith Nectarline and others kind of really kind of just spelt out what we're actually talking about. The literature on supported education is much more limited, but basically it's the same as IPS and those principles. But what you're talking about here is actually fulfilling of educational goals is part of that process. The vocational goals actually might be about completing education, going to university with a view of then kind of going into work. So that initial assessment, both education and employment have an equal weight in terms of understanding what works. For the employment specialist, they work just as much with teachers and tutors as they do with employers. So they've got different sets, different systems to kind of work with. If we think about it as the kind of follow-on support, actually it may be around kind of learning support that's needed for people, not just workplace support. A really critical bit, which I think actually has still yet to be really worked out and really utilised, is the role of families. Families for young people are absolutely critical. If you think about first jobs that you all got when you were kind of a young person, don't necessarily mean kind of your careers, etc., but your first jobs. Your parents played a role. They either kind of, in terms of kind of motivating you to just get out and find a job, or through their networks, they found you a job. I mean, it could be just a Saturday job, or just something like that. How we enable families to kind of return back to those kind of natural roles as parents and support their young person is really, really critical. But it's not an area that's been developed much. What's the impact of all this kind of on an individual? Here are just kind of two short stories from young people that we've been working with over this last couple of years. We've just been putting together our annual kind of booklet of stories. And I suppose for me it just kind of pulls together this issue around education is just as important as employment. And we kind of have to think about this as that kind of transitional journey for people. In 2010, a group of us kind of just wanted to kind of look at what's out there in terms of vocational rehab for young people with the first episode of psychosis. And we did a kind of literature review, but we also kind of, not quite a meta-analysis, but we just pulled together all the studies that existed. And it was kind of interesting just to kind of see what you get. Probably can't read what it says at the bottom, but basically the blue blocks of the graph are the kind of employment outcomes. The red blocks are education. And then right at the end, where you've got the green blocks, they're kind of actually they weren't really able to distinguish between education and employment because people were studying, but they also had jobs. So what you've got here, and it's quite interesting, this is New Zealand, where they took a pre-vocational approach, very much to train people to then place them. And you can kind of see they had success, 29% returned back to education and employment. A kind of variant to this kind of issue about, well, it's kind of IPS, but it's kind of not. This is what was going on in Barnaby's study. And you can kind of see at a control service, and you can kind of see actually by doing a form of IPS supported employment, great, mid 50% of people returning back to work. Some of our early work, we were able to get kind of 68% of people back to work. In New Zealand, we're going kind of just over 70. And then we have the kind of the first randomised controlled trial conducted by Rinaldi in Australia. And that's where you kind of see actually the kind of whopping big differences under kind of gold standard research conditions. What's going on? 84% of young people, with the majority returning to employment, and a smaller part education. In comparison to the control service, 29%. We did a follow-on study, we got up to over 70%, and then Keith Nectarline's study was the second randomised controlled trial conducted in LA, and you can kind of see he's kind of up to the kind of early 70s percent as against 30%. So we've got two gold standard RCTs. There's another two which are kind of being written up at the moment, echoing the same kind of results. What do we know in relation to kind of what we've done in our trust? This is just data from implementing IPS and then providing that support for people and looking at it from a kind of 24-month period. Typically, people under the EI teams are either under there for 2 years, or if they're really lucky, they're commissioned for 3 years. So we looked at it for kind of a 2-year period. And what you've got is the kind of the blue line is the employment rate, the pink line is the mainstream education rate, the kind of unemployed but doing some type of day activities is the yellow line, and then the kind of faint blue line is people who are unemployed, have no structure, and are completely unoccupied. If you think of it from a kind of public health perspective, they're the kind of high risk group in terms of their kind of mental health and their physical health, that kind of workless group. But what we find is at the start, people come into contact with services, 13% were in employment. So there was a kind of challenge, not only in terms of kind of helping people who are unemployed and wanted to go back to work, but also the job retention. How do we help people keep what they've already got? So at the start, 13%, but within 6 months, so rapid. This is entry into a first episode team. So not only is the kind of all the mental health support being provided, so is the employment support from that initial assessment. So within 6 months, over 35%, 12 months, 42%, and then 18 months and 24 months, 48% of young people back to work. The education rate fluctuates, and I'll come to that in a second, but it just, from a kind of real health perspective, just kind of looking at this kind of line here, and just seeing actually how we kind of are able to kind of enable people who are in that kind of high risk group in terms of their mental health and physical health because of that lack of activity and structure, how we manage to kind of reduce that down to around the kind of 5–6%.